No, I'm not Dr. Colgraves, but I am Dr. Bridget Funk, and I am the Quality and Safety Specialist from Sarasota Memorial Hospital. I've been involved in several of the FPQC initiatives, and recently, got to be the lead with Dr. Greaves, and so it was a pleasure working with all of FPQC on this initiative. And I want to thank everybody that before me, Robin and Mandy and Dr. Kane, because you guys just really set this up easy for me to go through the first aim or the first driver, which was readiness. So next slide, you can go to the next one. So this is the first key driver, primary one, readiness, implementation of a standard protocol or process. So the three things, which are our secondary drivers that we looked at and tried to come up with some great resources and really pinpoint what we wanted to monitor and track during this initiative, was to develop a protocol or process for identification, management, and treatment of severe hypertension. And then ensure that rapid access to severe hypertension medication, which we'll talk about each one of these. And then, of course, integrate a patient advisor in your QI team. And Mandy talked about how important that was, and then that underlying respectful care for the whole initiative. So next slide. So developing our standard protocols and processes, I think everybody kind of has some protocols and processes in place. Robin talked about the AIM initiative. We took much of our resources from their initiative. We didn't want to recreate the wheel again. And then we also took a lot from the CMQCC initiative on hypertension, and we'll see that on the next slides. But the standardized protocol, I think, just identifying those warning signs, maybe not necessarily having a diagnosis right away, but also then treatment of preeclampsia or eclampsia, including proper treatment of blood pressures that were accurate. And I know in the toolkit on the website, which I know FPQC will talk about, somebody will go through the toolkit with you guys, but there are a lot of resources for, proper blood pressure measurement, and just making sure everybody is kind of on the same page with that, making sure that, you have the proper fitting blood pressure cuff. There's nurse education as well as patient education, so it's very helpful. The timely triage process, making sure that you have fast evaluation of that pregnant patient. Our protocols that we looked at focused a lot about when that first blood pressure was to be taken, how often it should be taken, and then when does treatment occur? When can you, obviously, ACOG has guidelines, AIM has guidelines, a lot of different guidelines. And we just want to make sure that that treatment is within 1 hour of the first severe hypertension blood pressure. So, and we chose the 160 over 110 for that blood pressure. So I know that, you can have your own in your institution. We have our own. We actually have a nurse-driven protocol at Sarasota Memorial. And when the nurse identifies the second severe hypertensive blood pressure, she starts with the procardia and gets that on board right away, and then calls the physician. And I know that FPQC did some simulation at their kickoff in October. So I know our protocol is also in the toolkit, so you guys can find that there. And then, of course, escalation. I think it's important that, you have a plan, that there's a plan for what happens next, not just the, management of that blood pressure, but then how do you escalate the care? Does that mean that it goes to the main emergency room? If you have an OB emergency room, what happens with that patient then once you identify the severe hypertension blood pressures? Do they require transfer to a different hospital for, higher level of care? Then we also have some references and algorithms to treat hypertension. And then I know there's a lot of work statewide on aligning a lot of these protocols with EMS. So there's a lot of work still going on in the background. And I know Lori Reeves has been working on that with some of the physicians. Next slide, you can see that on the next slide, there are some examples of those algorithms. And we're not asking that you follow one in particular. We're not saying that we support any one in particular, just that you have a protocol and a process in place so that you can continue the treatment of that severe hypertension. And these are just a couple CMQCCs and then ACOGs. Some people are using Procardia first, others are going with the labetalol. So it's what your organization deems as the protocol you want in place. And then the next slide, ensure rapid access to severe hypertension medication. There was a great amount of talk about having toolboxes or med kits, available in your emergency room, whether it's an OB emergency room or it's a main emergency room. So that's another thing that you as an organization, you'll have to determine if you already have that in place. Some places that have the Pyxis or the machine and it's readily available and you don't need to consider, but you do have to make sure obviously that your medications that you're going to use are stocked in that Pyxis. But if not, then do you have a tackle box or something that you can put those meds in that are readily available if you're in a smaller organization? So make sure those key medications, the Procardia, the labetalol, and the hydralazine are all available. Make sure you have the right dosages available and easy access. I know some organizations have taken these algorithms, like we're on the previous slide, and they've actually laminated them and put them on the card or the tackle box with their medication. So it's pretty easy to identify, what's the next step, what's the next med, et cetera, and it's all right there. And then, creating a standardized order set. So you can do, if you already have one in place or you need to, change it or tweak it a little bit based on this initiative, now's the time to kind of get that in order. And the next slide. Here's the ACOG algorithm, and then the FPQC sample medication kit also as a resource. Again, these can all be found on the website. So those are things that are readily available for you. They're already there. And then the last slide is a patient advisor in your QI team. And Mandy talked about how important this was, having some of that community collaboration. We've collaborated with some of our EMS and particularly our main emergency room to help us really narrow down and focus on, making sure our patients are identified as pregnant. Like Robin said, we have that question built into all of our admission assessments, whether they come to the OB or ER or the main ER, or have you been pregnant within the last year? And then they're treated based on that. So getting that collaboration, I think, not just within the hospital, but outside of the hospital is a really good way. Our Healthy Start Coalition has been wonderful. They've dealt with some grant money and have provided additional blood pressure cuffs for us. So I say seek them out. They're a wealth of lots of resources for you. So, and that is all for the Readiness driver.